when you have the younger children with a positive ANA, then you start to worry about a higher risk for the eye disease.
How young?
How young do you worry about the eye disease? Or well, basically anyone diagnosed with juvenile arthritis, we send them to the eye doctor. But if they're below 6, we think it's more of a concern. So that's your 1-year-old or 2-year-old that presents with arthritis. And if they have a positive ANA and they're young, then we send them to the eye doctor every 3 months to get checked. And there's 2 kinds of uveitis. One is silent uveitis, and that's when there's no symptoms. So no eye pain, no red eye, but they have inflammation or white blood cells in the back of their eye. And that's detected by the eye doctor with something called a slit lamp exam. And they see the white cells in the back of the eye, but it's painless. Then there are other forms of arthritis, especially the forms of arthritis that affect the spine, that can give you a red eye or painful eye. So that in that case, the uveitis is easier to detect. But with many cases of JA, the uveitis is silent. So that's why we send the eye doctor for repeated checkups.
And you can have pain and not have pain with it.
Right, that's right. You could have absolutely no symptoms whatsoever and have an inflammation in the eye and not know it unless the eye doctor saw it.
Wow.
Yep. And the concern there is if you have ongoing inflammation in your eye, then you can start to lose vision. You can have all kinds of problems. So we always send the kids to the eye doctor on a regular basis to get that checked.
Yeah, I know that my daughter has to do that.
Yep. Yep.
And it's good, it's preventative.
Yeah, and then once some time goes by and they do the eye checks every 3 months and a few years have gone by and there's no problem, then we can start to space out those eye doctor visits.
So how often?
Eventually it can be spaced every 6 months. And then depending on which form of arthritis, some forms of arthritis you just need an annual visit because the risk of eye disease is so low.
Are you more at risk if you're systemic?
You're actually less at risk for eye disease if you're systemic. So if you're systemic arthritis,
that's interesting.
You go once a year. And systemic arthritis is when you have very high fevers, like up to 104. You get a salmon-colored rash that comes and goes, and then you also have arthritis. So systemic is less common, but that's the more serious form of arthritis, and that's when you can have inflammation not just of the joints but also the internal organs. So there could be fluid around the heart, fluid around the lung. We check on the liver, we check the internal organs, so that can be more worrisome.